Tom Quigley of ClaimLinx. Tom, how are you? And you decided to show us a new topic. We've always been talking about ClaimLinx and some of your friends, but you have another friend you've met, and this is something about some politics today and discussion
Yes.
that do relate to what you do. So I'm excited to have this conversation.
Sure. This is Sarah Chadzynski from New Hampshire, and you got to love New Hampshire. I'm actually sitting in North Conway as we speak, New Hampshire. So she's actually running for Congress, and actually this district here coming up in 26, correct, Sarah?
That is correct. Midterm elections.
She has got some unique ideas. She's a very interesting person. I actually met Sarah at an airport when both our flights were canceled at 10 at night. And getting a hotel in Boston isn't the easiest. In fact, I think the health insurance topic is a lot easier than that.
Sorry, we have to laugh knowing what the adventure of that evening was and trying to get a hotel that night anywhere within a 20-mile radius of Boston.
It was insane. And we had this, and then she's talking about she's running for Congress, and I'm like going, wow, the district where my office is. And I go, it's interesting. So I was asking her all kinds of questions. But one of the things I do remember we were talking about was health insurance coming up, particularly people who receive subsidies. In 2025, the enhanced subsidies are sunsetted unless Congress does something about that. And what's your take, Sarah? Are they going to do anything?
That's a great question, because it would have to be a bipartisan push to get something done at this point, because that was passed in that big ugly bill we saw come through to get enacted in 2026. I can go into the topic a little bit more, Tom. Stop me when you want. But the concern really here is that when we're looking at a whole systems approach to this, if we are taking away those subsidies, you're going to get a lot more people kicked onto Medicaid. And with a system that's taxed already, tax meaning maxed out and not supported or funded more, and often defunded in many states around the country, then you're going to have a medical system that's taxed because people are not going to get preventative care. And so they're going to wait until they are so sick they cannot avoid care, go to our emergency rooms, and being not covered, that will rack up financial incurs in the emergency room. That then this full cycle then comes back to us with increasing our individual health insurance premiums and other healthcare costs. It's all connected. When I hear people say, it doesn't affect me, I don't get these subsidies, it affects all of us because it's a whole system. And so I think that's the concern that we have here, is that this should not be a partisan issue. This should be an issue with having a healthy healthcare system and people being able to access preventative care, so they're not taxing the system, increasing our costs or other people's costs on our own insurance premiums, etc. That's a big concern to me. I don't see any inclination or any ripples from Congress right now that this is going to change, and it is imperative that it does.
Now, let me ask you this question. This is an interesting point you've brought up, Sarah. Find subsidies for our audience.
So subsidies, and Tom can chime in probably better than I can on this, but essentially in the ACA, there are subsidies put in place for people to be able to get healthcare coverage on the marketplace that allows them to have preventative care, to have regular health care and health insurance. And there are some people that have, for example, just emergency care. And that also puts a tax on our system because they're not doing that preventative care. So those subsidies are actually essential for people staying on insurance that allows them to go visit their doctor when they need to.
So Tom, can you go add to that and give us an example of how that's done, how you utilize that with some of the companies that work with ClaimLinx?
Sure, but you take a family of four in New Hampshire. We'll use New Hampshire, and they're making $100,000 a year, which is okay. But under the Affordable Care Act, before, it was like they'd get a little bit of a subsidy because of the fact that they were under 108,000 for 400% of the federal poverty level. So what they did is they enhanced it during COVID, and they enhanced it so that people would get, maybe instead of paying $1,500, they would pay $500 for their health insurance, which made total sense. And quite frankly, people don't think it through. If you think about a business, a small business, say they have 10 people, if they have a group health plan in place currently, they're getting to write off 100% of it. Okay. I actually spoke to Jim Jordan on this one in Ohio. So Jim, I said to him, Jim, you guys are missing the boat. The small businesses can't, if they design their health plan so they allow the employees to get subsidies. If they're paying $2,000 a month per person, how much does Uncle Sam get of that? Zippo, because it's all covered 100%. So if you could get them down to a zero premium if they qualify, now that $24,000 that was out the window is back in, and now it's taxable. Guess what? That more than pays for the enhanced subsidies. But see, the problem is the system. Like, take New Hampshire's Department of Insurance doesn't allow small businesses to have plans that Massachusetts and Maine have access to. Those are level funded health plans unless you have more than 50 employees. Where in Massachusetts, I believe it's down to 3, and in Maine, it's 2 or 3. In level funded plans are ACA compliant health plans that are deemed self-funded, and the insurance company takes advantage of the law. They create these plans that for a consumer is still fully insured. It still covers all the preventative, everything. And the premiums are half the cost if you have a healthy group. But the Department of Insurance in New Hampshire refuses to allow these plans for whatever reason. So Massachusetts, Maine, no problems. So the other problem they have in New Hampshire is the network. You have these individual plans. If you were in Maine, Vermont, Massachusetts, you can go to any hospital in New England, particularly the Boston hospitals. New Hampshire has plans, doesn't cover, most of them do not cover the Boston hospitals on these exchange plans. So you have these people who are buying Harvard Pilgrim Group because they want Boston hospitals on the plan. But if they were buying individual plans like in Maine or Vermont, they're already built in. There's no reason why they're not. They used to have the plans that did. And again, that falls on the Department of Insurance. I have no idea why they don't. So my question's really the way it has to be fixed. And in terms of the government is exactly what Sarah alluded to in the beginning. You're hired for your constituents. Doesn't matter if you're Democratic, Republican, Independent. Your job is to do what's in the best for your constituents. New Hampshire needs subsidies. These folks, a lot of them will go uninsured. She nailed it right on the head. Maine, same deal. Vermont, almost every state. These people have to work together to fix the problem instead of fighting. It's just old. That's where we need refreshing people such as Sarah. I don't care if Sarah's liberal, conservative, independent. Sarah has a smart mind. Most people running for Congress, new ones, are very sharp. It's time to put in the people who are different, think differently in place and let them have a shot, because these people have been in it for 20, 30, 40 years. They just refuse to work together. Time for them all to go on both sides. Put them in.
Good, sir.
I appreciate that, Tom. And I think looking at what is happening on the state level of New Hampshire is also an important piece to bring out, because there's multi-layers here, right? There's the state level. Yeah. And then there's federal. And what happens at federal trickles down to state. But if it's not working at the state level, it doesn't matter what's happening at the federal level. But if it's not happening at the federal level, then you can't do anything at the state level. So you need both pieces of that puzzle to fit together to actually make sure that people have access to good preventative care and to insurance that covers them when they need it. We can have a much bigger conversation about our healthcare system as a whole, but on this specific topic right now, before revamping our entire healthcare system, this is an need to make sure that people are covered and are able to find that care when they need it and not tax our system in emergency situations.
Now let's talk about,
take yourself now. So if they change subsidies, I mean, let's say you pay $50 a month for the heck of it for employee children coverage, and you go up to now $1,100 because you don't qualify for subsidies. A lot of people are just going to say, screw it, I'm not buying health insurance. Exactly. So they go and they buy like an Aflac policy or something that doesn't cover anything. It covers for specific, but they don't cover the other stuff. So what do? Exactly what Sarah says. You go to the emergency room. Why? They have to take you, and you can set up payment plans, plan bankruptcy, whatever, but you have no other choice because the regular doctors won't see you because you don't have insurance. It's insane what's going on.
And
so what they have to do is they have to work together to create a solution that eliminates this nonsense. Every time there's a new president, everything changes, and they all have to work together because, like it or not, the government have started getting involved in healthcare when they put in Medicare way back, and then they put in ERISA laws, then they put in HIPAA laws, and then they put in the Affordable Care Act. And I have no qualms on any of it, but they have to. The other thing that's happened is all the insurance companies have become corporations that are stopped. The problem is government and them don't mix. So the solution to health insurance is simple. You can steal this from me if you like and use it. Is every American, the government puts a $50,000 deductible on them when they buy the reinsurance, cover it. Underneath, you can buy whatever insurance you want. That is, you're getting subsidies if you're lower income. Now you now have added about 50 new companies to the mix that will cover a $50,000 risk. And now you have just solved the health insurance. The premiums go down to a couple $100 a month. The tax savings alone pays for the reinsurance. End of story. Problem. Lobbyists.
So I'm going to ask Sarah just now to get your part. We've talked that topic. That was an awesome topic, Tom. Get you involved in one and where you're really excited about it. Wow, Tom, that was fantastic. But now, Sarah, I want to jump into specifically what makes you different than you're running in the midterms. Why should people vote for you compared to who's already in that you're going against your competitors for this position?
Thank you, Neil. I appreciate that. If I may respond to Tom real quick and just say this is in line with an answer to that question, in that I recognize I'm not a specialist in everything, and that being a representative of the people means reaching out to the community and truly being a team to find experts and resources to come up with solutions to these problems. There are solutions to these problems, and Tom just shared one of them that I think should be seriously considered and fielded. I also think that we need to have healthcare for everyone at a baseline. That is a standard. It is done around the world. It can be done. We can look at those systems. We can evaluate them. We can say we like this, we don't like that. That works there. I don't think that would work here, and workshop it. Right? We have that ability as humans. And just to dovetail off what Tom was saying about the emergency room and care, one of the things we also see is that having these subsidies go away means parents will find themselves choosing between feeding their kids or purchasing health insurance. And I think we all know what a parent will choose. And that means that parent will defer their own healthcare because it's not an immediate need. And then it will continue that vicious cycle. So to come to your question, Neil, about what differentiates me, the reason I got into this race in the first place, my background is in teaching and nonprofit leadership, but I've been working with communities across the nation, specifically the Ukraine supportive community here in the States, organizing and bringing people's voices to their elected officials to advocate for Ukraine and to work on finding solutions for our national security. And through doing that, I found, because I was doing this work simply because it was the right thing to do, that I was building relationships and establishing connections that I can offer as a service to our state and our nation at this time. Whether you're on the left side or the right side, legislation is like guerrilla legislation at this time. Nothing is happening business as usual. And I'm bringing myself to the table to offer my skill sets and my abilities that I've been establishing and developing simply by doing the work I believe is right. And it's up to the New Hampshire people who they think is the right person to send to Congress.
Interesting. And you're different because you're not like the establishment, it sounds like. what you're saying.
I am a Democrat, I will say that. So I am part of the party, but no, I have not been an elected member of the party. I'm not part of the establishment. I'm part of the community, and I'm a community organizer and community worker. And I think one of the things that came up when there was a conversation about whether I was going to run or not, because running means stepping away from the work that I've been doing to protect it and to focus on running, was, do we have a chance at winning? Because my background is very logical in that I look intention and impact and do they line up, right? And my intention here is to help the people of New Hampshire and therefore to help the people of the United States of America, right? And so looking at that and in talking with people on the ground, they said, wow, Sarah, you're someone who goes to the grocery store. You're someone who understands what it's like to live paycheck to paycheck. Neil, I was a single mom. I know what it's like to go in and apply for food stamps. It's an incredibly humbling experience in a situation I never expected myself to be in. And so when we're looking at some of these supportive measures that we put in place to help people, I really feel that. So yeah.
All right. Tom, any other thoughts? That was great, Sarah.
Gosh, you've got to learn in this country how to get along. I don't care. Again, I lean more the other way, but 5 minutes after talking to her at an airport that just got our flight got canceled, I realized, hey, this girl's kind of somebody who would be a good, she gave me her card. And I was just like, you're really running for Congress? Because I didn't believe her at first. And she hands me her card. I'm like, holy blank, she is. And I started talking to her, basically how I talked to her today. Hey, and the deal is health insurance is a vital part of the political arena right now. And a lot of people don't realize this. They don't understand what's coming. I see it clear. I'm looking through clear lenses and literally, yeah, it's coming. And a lot of people better understand the ramifications of this on both sides. Believe it or not, I do think the left side has a better understanding of it than the right side right now. The right side, they go through times, each one, they get tunnel vision. They just don't think the ramifications. If you do something, you got to understand there's consequences.
Exactly. So
I don't think either one likes the consequences that's coming.
And that's exactly it, Tom, right? It has to be about the people. The policy has to meet the needs of the people, no matter what your party is. And we have lost sight of that on both sides of the aisle. I had a chance to thank Senator Romney for putting his health insurance plan in place in our neighboring state down below in Massachusetts. That was a Republican governor that put in comprehensive health care insurance reform in Massachusetts. We've seen this across the aisle. We've seen this as a bipartisan topic.
Look at Clinton and Gingrich got along, and Tip O'Neill and Reagan got along. There's no reason this doesn't happen.
No, this has become a divisive situation for the past 20 years. It's because of clickbaiters and how social media wants the most extreme content out there, regardless of what side it is, and just not looking at reaching apart across party lines. I go by, as a marketing agency and a show that I interview everyone, I don't care who they are, is I go by Michael Jordan's quote, Republicans buy shoes too. And I look at it like we all must get along, and I'm not going to take either side. I'm going to hear everyone's side and not say, oh, this is right or this is wrong. No, you have to figure out what's best for the people and come up with a bipartisan opportunities versus this where we're not going to work together at all.
Well, what is it just all of a sudden cut these people's lifeline off?
Oh, no, and it's a okay thing, and we should celebrate.
And people are going to be going, some of these folks, $45-50. Husband, wife, 62. The cutoff's going to be, let's say, 75,000. It makes no sense. So now all of a sudden they'll get no subsidies, and their premium will be $1,800 a month versus $2.
That's a big issue.
That's huge, and
It's
that's
coming.
again. And so that's why you have to look at the next vote. When is your midterm, Sarah?
September 2026. So we're a year away.
Oh, you're away. So so lots going to happen. That's the big midterm, right? That's going to be the one that's going to decide if everything that has been voted on is what people want. I'm intrigued by that. And this is me. And this is how I am, Tom. I don't even watch the news anymore, but that's me. I get the news from my show, by the way, Sarah, because I interview everyone. They can tell me both sides, and I know what's happening.
I tell you, insurance is an issue.
Because
This is a major issue.
Yeah, because
in this, yeah.
oh,
I mean,
healthcare is huge.
so oblivious.
But Sarah, if you can come up with what Tom has and go ahead and and Tom, this is a great idea. You need to be the one bipartisan to make the healthcare program work, but it's not socialized medicine. Don't hear me on that, but something that's really makes sense, like what currently is happening with subsidies. It helps people. It's a need that you need to provide. It's not like you cut them off and say, oh, by the way, just be so ruthless. No, certain things, yes. Higher taxes, I'm not going to be happy about that. But if you're looking at, if I'm going to pay more in taxes, it better be to help people, not a bunch of pork bills. At the end of the day, it's about the people. And like
Yeah.
education, we have to better figure out ways to have a better education system. All these things are why you have to look at the voting booth in 1 year. Sarah, I guess so how many people are running in the midterms against you and for the primary? Yeah.
Currently, there are 6 of us, including myself, in the primary, and 1 who is considering. I think we'll know more in 5 to 6 months what candidate is really resonating with the people. And then we'll be able to figure out how things are looking for the primary. But it really does, it falls in the people's hands, Neil. Just like you said, it'll be very interesting to see how people are voting next year as to how this is impacting them. One of the things that I'm so concerned about, Neil, is that what the current legislation and policy is doing is squeezing the American people. And when people are squeezed or feel trapped, we end up seeing violence, right? We end up seeing what we've seen recently. And that breaks my heart. And it doesn't mean I agree with any of the ideology that was shared or that sort of thing, but we should be able to safely function in this country and find solutions together. And when you have extremism come in on either side of the political spectrum, you lose the people-centered values. And then you end up with policy that hurts people.
Exactly, because they don't care. It's about the bottom line of their party versus what's best for the people. Party versus people, very interesting thing. So just to give you my advice of working with a client that I did a podcast with throughout a primary type thing, running for 6 people for this House of Representatives. You're running for the House, right? Is that correct? Yeah. He was running for Congress the same way for Senate, and going through the whole process of that. The challenge is, how do you differentiate yourself from your competition? It's raising money. At the end of the day, it's all about fundraising. And how are you going to find people that want to give to say, you're going to be the best representative for New Hampshire? So how can we do that? How can people go ahead and donate for the cause and join the whole, either their time or money, to help your campaign?
Thanks, Neil. I really appreciate that. And I think one of the things that we're looking at in terms of efficiency and efficacy and impact is, yes, we need funds to operate. A campaign is like a small business. My team gets paid. I do not, but the team gets paid because they're doing incredible work. And it's not about necessarily how much you raise. Yes, there's a threshold. There is a budget, there is a number, but it's how you use those dollars as well. And so we have a great plan to do that, a great field team, and otherwise. If people want to get involved, they can go to the website, sarahc603.com, and click on the volunteer sign up, click on our Act Blue and donate, and we would love to have people involved. I also want to point out, Neil, that on the website, there's a little button that says Talk to Me. And if people click on the Talk to Me, they can submit their questions, their concerns, their thoughts. And I'll be starting soon by responding those on something we call Talk to Me Tuesdays and posting that on my social media, because we really want to stand by the fact that representation is a conversation, and the people have a voice in this process, and they deserve to be heard, and they deserve to be answered. So sarahc603.com.
And if you want to get the best healthcare coverage possible, go to claimlinx.com, especially if you're a business owner. Appreciate it, Tom. Thank you, Sarah.
Thank you, Neil. Thank you, Tom.
That was a special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast, guys.